Hello and welcome to the CCNL first Keeping the Kids in the Classroom series that we are offering this fall. Today's presentation is Military Kids, Social and Emotional Learning from Dr. Jennifer Thomas. This is a topic that's very near and dear to her heart, some original research that she'll be sharing with us. And I'm going to hand it over to, before I do that, one comment, since this is being recorded, if you do have specific questions, the author, Jennifer Thomas, is willing for, it's okay if you want to email her directly, and she will have her email in the presentation. So you could email her directly if you've got specific questions. So having said that, I'm going to go ahead and turn it over to Dr. Thomas.
Hi, everyone. I have my video on now, but I'm going to go ahead and just shut it off just because my internet is a little wonky this afternoon. Let's do this. Okay. So just a couple of disclosures. None of the planners or the presenters for this educational activity have any relevant financial relationships to disclose with any ineligible companies. Successful completion criteria includes 100% attendance and the completion of an evaluation form. And Pacific Lutheran University for Continued Learning, or the PLU CCNL, is approved as a provider of nursing continuing professional development by the Montana Nurses Association, an accredited provider with a distinction by the American Nurses Credentialing Center Commission on Accreditation. So thank you so much for being here today. The social and emotional well-being of military children, particularly military adolescents, is something that I am really, really passionate about and I advocate for. I am so excited to be able to present this information to you today. We're going to talk about some military demographics. We're going to identify what military transitions are and some of the social, emotional challenges faced by military children. And then I'm going to go into what supporting military children from a nursing perspective looks like, ensuring that I bring in some of my past work looking into identity and high mobility, as well as the impact of the pandemic and what that has done with our military children. So before I get into all of that, I would like to provide you with a little overview about me. Again, my name is Dr. Jennifer Thomas. I've been a registered nurse for over 20 years. My clinical background has always been in adult med-surg settings, but I have spent the last decade in academia and staff development within the acute care setting. In addition to my nurse educator roles, I also serve as a school board director for the North Thurston Public School System in Lacey, Washington. And in addition to the professional and service experiences, I'm also a military spouse. My husband is active duty, and we have 5 children ranging from ages 12 to 18. And throughout my husband's over 19 years of service, we've moved on average every 2 years, 7 moves across the states, living in 10 different houses. Now we're in Washington and we've loved it so much. This is the longest place we've ever been stationed, and we're planning to finally plant our roots here. So when I began my PhD program, my oldest son just experienced a mid-year move during his 8th grade year. And he was going through some really tough times. And as I looked deep into the literature, I found that there was a true gap in understanding the impact that high mobility had on military adolescents as it pertains to identity development and that process. And an even bigger gap of looking at this phenomenon from a nursing perspective. So can you guess what I did my dissertation on? My study actually focused on understanding the lived experiences of highly mobile military adolescents in search of their identity from a nursing perspective. So I have published my work in the Journal of Adolescent Research, Nursing Science Quarterly, and the Journal of School Health. I've researched and written on adolescent adaptation and identity development when faced with the experiences of high mobility, and the same phenomenon in military adolescents who lost a parent to suicide. These were done pre-pandemic, and during the pandemic, I completed another study on the impact of the pandemic on a transitioning military child. In addition to these publications, I've also disseminated my work at international and national conferences, including the 45th and 46th biennial Sigma Theta Tau International Biennial, the 2021 Military Child Education Coalition Conference, and the 2021 Tri-Service Nurse Research Program Conference. In addition, I did a presentation in partnership with the Military Child Education Coalition for School Nurses in Hawaii. And with all of this said, it's really important that I note that much of the material that I'm going to present to you today will be focused on the high mobility aspect of military life, and will be a collection of information used from all of these presentations and sources. And I wanted to give a really huge shout out to Dr. Amanda Tremillos, a military spouse and school educator, as well as Ms. Stacy Huseman, a military spouse and a military journalist, who I've partnered with on several occasions to ensure that we have the most relevant information to disseminate. And I'll be sure to provide the list of the resources as well. So let's start off with some military demographics. According to the 2019 Defense Manpower Data Center, there are approximately 1.3 million active duty military personnel, and roughly 36.5% of them have dependent children. Of the dependent children, just over 372,000 are between the ages of 6 and 18. Another interesting fact is that the United States Armed Forces orchestrates anywhere between 420,000 and 450,000 permanent changes of station, or PCS moves, for military families annually, according to the U.S. Transportation Command, and about 40% of them take place over the summer. Now, this said, military-connected students truly are a major consumer of public education across the United States and throughout the world, moving between 6 and 9 times throughout their K-12 experience. In fact, military children experience changing schools 6 to 9 times beyond the traditional changes, opening doors for increased social emotional challenges to really occur in this population. Oops. Okay, so one pre-COVID survey conducted in early 2020 was the Military Child Education Coalition Military Kids Now Education Survey, which gave us a snapshot of these top emotional challenges military connected students face. Now, these include making friends, feeling of acceptance or fitting into both school and local culture, building self-confidence, dealing with parental deployments and reunions, and managing stress. Now, again, these are all pre-COVID. So can you imagine the amplification of these types of challenges over the past 2 years? As nurses and advanced practice nurses, you've taken this really proactive approach in learning more about the population that you serve. So many people ask, why does support from the nursing perspective matter at all? Well, it matters in so many different ways. First of all, we are one of the most versatile professions. We work in so many different settings, including acute care, healthcare clinics, community and public health settings, technology, and much, much more. And we serve as bedside nurses, educators, advanced practice nurses, policymakers, politicians, and again, so much more. So we have a unique perspective of care that encompasses this holistic view of a patient's immediate and surrounding environments. Therefore, we are one of the most influential professions to be collaborating with when it comes to caring for and supporting this population and other diverse populations as well. Our holistic education background provides us with this opportunity to address social and emotional well-being, development, mental health, healthcare, disease prevention, and health promotion. But the question is, what exactly does this care look like? Well, to even begin thinking about care, you have to understand what exactly military children go through. What are their lived experiences, and how have those lived experiences attributed to some of the potential social and emotional challenges that we see? That we want to actually catch early as well. So now what I want to do is I want to go over a few of the research studies that I've been part of in order to bring meaning to the implications for nursing practice that I'm going to provide a little bit later in the presentation. Now, the first piece of work was a study completed pre-pandemic on the lived experiences of highly mobile military adolescents in search of their identity. So with this particular study, I used the Roy adaptation model to understand what adaptive behaviors versus maladaptive behaviors look like, and how nurses could support adaptation to life-changing events. Since my focus was on the highly mobile military adolescent, I also used the identity status theory, as this was the developmental stage of life adolescents are in. They're looking for their identity. They're searching for their identity. They're going through identity crises. So within this qualitative study, 4 major themes rose, including self-perception in the world, relationship building, emotions, and healthy transitions. And there are also several sub-themes that came up with this as well. And we're going to explore each of these themes and sub-themes throughout this presentation. So let's begin with self-perception in the world. Self-perception, or how we see ourselves in the world, shapes how we live in the world. High mobility as a military child could affect the way that military adolescents in military families view the world around them, which participants in this study have shared as being both positive and negative. Now, worldly view came up as a sub-theme as participants experienced different people, different locations, and different cultures that really helped to shape their understanding of diversity in the world. A place to call home emerged as a sub-theme as the participants sought to understand where home was and how a place to call home affected their self-perception. Milestones that adolescents missed due to high mobility lifestyles they faced also became a focus, as many divulged what they felt they were missing compared to their non-military adolescent counterparts who were not highly mobile, including friendships and social connectedness. Now, further, the participants also shared their thoughts on their own personal identity and their struggles with identity exploration. It became apparent that the theme of identity exploration was heavily based on their self-perception of how they fit into the world around them, wherever that might be. The next major theme was building relationships. When speaking to the participants, it became apparent that moving frequently affected their ability to build relationships. And it really contributed to them diverting from who they truly are. And the social process and trying to connect with their peers their age had been a source of anxiety for all the participants within the study. Their thoughts and feelings, both leaving peers and finding new peers, were really emotionally exhibited and deeply rooted. For many participants, each move involved the act of passing or the process of being accepted into a new community or group through undetected integration. Each participant shared some deep insight about this, even going as far as naming the action of the changing ways that they had to act or the personality in order to fit in. Finally, parental relationships. This emerged in a few of the participants' responses. the impact that different parental relationships had on adolescents' ability to cope was really interesting to see. There were varied responses and experiences divulged that reflected on positive relationships as well as relationships that were struggling. Now, the two next major themes were overwhelming emotions and healthy transitions. And as I thought about the information that I really wanted you to truly walk away from this presentation with, that would allow you to understand and learn how to best serve this population, I felt that these two themes right here would make the best impact. So not only will I present the theme, but I'll also connect you to the experience through quotes from participants in their interviews. So overwhelming emotions was the most supported and impactful theme. These emotions were subjectively and objectively noted throughout the interviews. Feelings of burden was a sub-theme that seemed to resonate heavily with participants. Participants really often felt that they could not open up to their parents because they did not want to add to their stress and add to the stress that their parents were dealing with. One of our participants, Alyssa, mentioned, so it's like, I don't want to put myself first and say, because I'm not really that type of person. I don't want to just complain to my mom about something she can't control or she can't change. So I don't really talk to her about most things. You can't really just say how you feel, because I don't really want her to feel like she's the reason why I'm suffering, you know? Grief and pain also emerged, but nearly all participants either explicitly stated or suggested that they never spoke to anyone, including their parents, about the pain. They really felt and throughout the interviews, they really exhibited this. There seemed to be a sense of some relief, even just to state what they kept inside so much through the interviews. Vendetta stated, the final emotional sub-theme, Vendetta stated that every single move, the most devastating part was not that we were moving again, it was just losing people. And I feel as if that's probably the hardest thing on all military kids. And after a while, after you move like 2, 3, 4 times and so on and so forth, you just kind of numb yourself to it. Now, the final emotional subtheme to emerge was lack of control. And participants felt the need to express more of what was expected of them and less of what they wanted. Victoria mentioned, you just have to say, all right, this is where I am now, and this is how I have to live. So I'm just going to do it. I'm just going to, forget about whatever I grew used to, because I can't go back to that. So I just have to overcome it. So what can we do as we begin to understand how military connected kids feel? Well, after they had the opportunity to really communicate how they felt inside, I asked every participant the exact same question. I asked, what do you feel that nurses and providers like physicians and nurse practitioners can do to better support you? I wanted to share with you the first 2 responses that made me feel all kinds of emotions. The first was, a doctor has never asked me how I'm feeling unless it's physical, so I don't know. And the other was, nurses, I don't know, because we don't really try to talk to nurses like that. Other participants shared that it would be nice if nurses and doctors would just ask. Also, another participant stated, I feel like during a physical, they say, do you feel safe at school or home? I feel more like instead of asking, do you feel safe there? Maybe follow up with, are you feeling okay in school? Like, are you good with friends? Are your grades good? Like, what is your mental fortitude? That should be an important question, because the physical health and mental health are like key important things in every person's life. You can't have one without the other. Now, that was a full quote from a 16-year-old male that I interviewed. So you could kind of get an idea of how amazing some of these kids are. All of these kids are. So there truly is so much to unfold here, but we are not even close to being done. All of this that the kids were experiencing and the information they divulged was pre-pandemic. So you can imagine what it would be like if these kids were told that they were moving during the pandemic. I know that I couldn't even imagine doing that. I remember when we transitioned our kiddos into remote learning and then hybrid learning and then back to remote learning and then fully in person. I felt so overwhelmed, and dealing with all of that and a move, it's so much. So to truly understand the impact of this phenomenon, I put a team together from various disciplines, including education, nursing, and primary care across the country. And we conducted another study that looked at the lived experiences of this population from a multidisciplinary perspective, focusing on how to best support them in the public school setting. And this study was called MAPS 21. We specifically looked through the lens of the social ecological model for health promotion to understand how their experiences impacted them at each level in order to begin identifying how to support them best when they transitioned back into the schools. Now, for this particular study, we interviewed dyad, triad, and quartet family groups to include both adolescents and parents. So let's begin with the most immediate level, which is the individual. Now, the manner in which military-connected kids view their own experiences internally is important to understand because it brings further insight to how and why they transitioned the way that they did. And often they experience anticipatory processes in other words, they anticipate the processes of moving, separating their belongings, the packers are coming in, the movers packing the truck, traveling, waiting for goods, and so on. But the pandemic messed those anticipatory processes all up. There was really an increased stress and so many unknowns, which led to increased anxiety amongst both the parents and the adolescents. Now, throw in a parent deploying or a sick family member in the mix, that just amplifies everything. Now, the pandemic also took away a lot of control that the adolescents and the parents had in order to create smoother transitions. And this in turn led to periods of maladaptive behaviors, which really impacted the overall transitions. It was a major influence in many accounts of self-reported symptoms of anxiety and depression. Now, one of the participants, Nilo, stated that I think that I'm not as happy as I used to be. And there's another side of me that I wish to express where I can sing, I can dance, I can just be happy the whole time. And I can't do that here because there isn't a theater here, and especially because of Corona. They are taking extra precautions there. And I know from my friends, but here, everything is either just shut down or there's nowhere to go. It's just not cool. So many participants felt a sense of growth and maturity as well through their experiences of moving prior to and during the pandemic. So while this could lead to greater adaptation, which it did in some, the increased sense of responsibility placed even more undue stress on those who transitioned during the pandemic because of the lack of connection to peers and the surrounding community. Relationships within the socio-ecological model are very important because relationships or lack thereof directly impact individual adaptiveness. And those who are closest to the individual or who play a major part in their overall interactions and lived experiences can really influence behaviors as well as responses to stress. Now, this could be parents, it could be teachers, it could be friends or coaches. And in this study, we really saw a connection between parental views and behaviors and adolescent views and behaviors. And one of the parents mentioned, I mean, they've seen us struggle with this. This was, an ugly PCS. There were days that I cried and I had a meltdown and I had a big fat tantrum trying to figure things out. And sometimes I think they need to see that because it's not all roses on my end. We're not doing this just to make it difficult for them. This is just freaking hard at times. Another parent said that they tended to mirror our emotions. When we were frustrated, they were frustrated. Now, we spoke about the impact relationships have, but what happens when those relationships aren't formed? Distancing, mask wearing, isolation, virtual and hybrid learning, environments, all of these were mandated during the pandemic. And what was really stressful was that each state and their local government differed in their levels of precautionary measures, especially within the school systems. So this created even more confusion and anxiousness and even depression at times amongst both the participants and their parents. And the distancing and inability to connect with others when moving during a pandemic led to relational isolation and prevented the kids from being able to say goodbye or to friends in the manner that they normally would, and making friends at their new duty station. One of the adolescents mentioned it was definitely really hard and lonely and really stressful and really easy to get depressed. So, and another parent stated, so just the seclusion, more seclusion, like you go to a seclusionary during a normal move, but with COVID, it was twice as bad. Now, these quotes and this theme heavily resonated with me. And I think that it heavily resonated with me and the other PIs in this study because we were all parents of highly mobile military adolescents. So we understood what that was, and it made us self-reflect on how are we ensuring that we as parents provide that type of environment for our kids, and how are we advocating for that type of environment within the school systems or wherever they they spend most of their time, whether it's within sports or band or any of that. So it's really important to continue to connect with those who influence the adolescent lives. So community support is a necessity for military families. And this really often stems from schools and the general community around them. There are many different organizations that truly advocate for military children, especially within the school setting. Of course, MSEC, the Military Child Education Coalition, is one of the most influential ones. And we also have MIC3 officers or representatives in each state that are appointed by the governor to help to navigate transitions. And within this study, school support was the most heavily data-driven subtheme. There was a combination of both positive and negative experiences, which directly impacted the health and the well-being of these kids. And the data reinforced the major role that school support could play in military kid outcomes, especially from an interdisciplinary perspective. So for one of the participants who was battling depression for the first time in her life, it was really devastating for her and her mom. And her mom stated she didn't have sports here. She definitely slipped into a depression to where by Thanksgiving, she wouldn't even get out of bed. I've watched this girl deteriorate so much. School really made her, these are literally the words that came out of her mouth. She said, "Mom, I used to feel like I was the good kid at school, and here I feel like I'm one of the worst. The surrounding community also played this major role in the transitions that they experienced during the pandemic. And adolescents often just wanted others to understand what it was like for them and to be more compassionate and accepting. So while these experiences are there, they wanted to also feel validated in the experiences that they were having. Finally, I wanted to address the impact of society and policy on the overall well-being. There were a lot of participants within this study that shared their thoughts on larger changes that could create a smoother process, that could impact organizational policy and change, that could impact national advocacy for awareness and professional development opportunities. And the adolescents and their parents really wanted their experiences to be heard and to be the driving force towards better academic, social, emotional, and health support. Now, before I get into supporting military children from a nursing perspective, I wanted to go into this study just a little bit further and just close off the study with a couple of different things. First of all, it's really important to understand the overall impact of military transitions and what this is going to be like for the next couple of years for military adolescents, especially those who have moved during the pandemic. You know, on top of the issues that many of our children within this country and within the world are facing due to pandemic, the impact of high mobility and moving to places where there's not that sense of comfort, during that pandemic time has created a source of anxiety for many of our students and many children. And it's not only within the public school system, but also, our homeschooled children are those who go to a private school setting, and those who are in and out of the K-12 system as well. It's a resonating effect that not only has impacted our children, but it's also impacted the adults. And it's really important to understand that the impact that we as adults have on children is really reflective of how we role model the behaviors and help children to navigate what they're feeling and how they're feeling. So when we go into supporting military children from a nursing perspective, the implications for professional and clinical practice, I want you to take a moment to think about what have these studies, or what, based off of what you've heard today and the quotes that you might have heard today, what are some things that you're going to apply to your own practice as nurses in order to ensure that you're going to be able to meet the ongoing needs of the military adolescent, or the military child, or the military family, military spouse, or the active duty member. I'd like you to take the next 2 minutes to really just go into self-reflection mode. At the end of this presentation, I'm going to have my email address up and running. I would love for you to email me some of your self-reflecting thoughts, so that this way I can place it into some type of document that collects that all together in order to share and continue to share with nurses across the country. Because it's really important that I hear from the nursing perspective what your thoughts are on supporting this population. So I'm just going to give you 2 minutes to write down some self-reflection, and then we'll move on with the presentation. Okay, we're going to give about another 30 seconds for self-reflection. Okay, so man, when it's quiet time, it's like time goes by so slowly. So I hope that you guys have had some time to really self-reflect on some of the information that I provided today in with those studies. And what I'd like to do is go into what this means for practice. Well, we're taking the first steps really right here. Interdisciplinary professional development training really focuses on serving the military child from an interdisciplinary perspective. And there are wonderful sources of support, but support is often siloed towards specific disciplines. More interdisciplinary effort amongst military connected healthcare professionals, public school staff, and administrators, educators, and mental health professionals to really identify the effectiveness of professional development strategies through a multi-expert lens is needed. So when I talk about this, and this is something that I continuously advocate for, especially in the school systems, is that nurses bring an amazing perspective to the overall care of students and to the overall care of families. We are taught to be able to look at things from a holistic lens. And oftentimes, especially in settings that are not typically a healthcare setting, but in a community setting like a school system, nurses are not often utilized to the greatest potential that they could be, which is really the education aspect. And I think that there is great opportunity for nurses, especially in the school settings, to be able to provide the interdisciplinary professional development support. In caring for military children, especially when it comes to social and emotional needs. Now, across the country, social and emotional learning has become a huge part of the current school days. One of the reasons for that is because we've found that, or many have found, that when you're only addressing the academic needs of students, you're missing a huge part that allows us to draw them in, to be able to support them from that holistic perspective of social and emotional care, as well as allowing them to understand and identify the supports that they have in and out of the home are really, really imperative. And so that social emotional learning within the school system can really be driven by school nurses and healthcare providers who provide that education, especially to school staff and educators. So next is assessing for physiological signs and symptoms of emotional distress. It's important to be able to identify those physiological signs and symptoms. We know that different stressors within a child's life is often internalized and it can manifest in many different ways. Not everyone who walks into a clinic with a tummy ache is experiencing some type of emotional distress, but when patterns occur, that should be an indicator. So there's also an amazing opportunity for providers within the school setting to educate, again, those non-healthcare staff and on the physiological symptoms that they might see as a result of the physiological or the mental stress that they're going through. This way, early referrals and more in-depth assessments can be completed by the school-based health clinics or by the school health team. And this leads to the next implication, which is asking questions. Now, before we get into asking questions, I wanted to talk a little bit about the school teams. Many times when we talk about, school teams, we talk about the educators, we may bring in the psychologist, especially when it has to do with learning needs. We may also bring in some special educators or parents, so many different perspectives. Oftentimes, we miss our nurses. Our nurses are an important part of the intercollaborative team. So it's really important to engage them in the process because they can provide some understanding to some of the things that maybe not, that don't come up in the meetings that have to do with education or mental health needs. They could talk about those physiological symptoms that occur that many miss because they don't truly relate what you might see physically to what individuals might be experiencing mentally. So the next thing or the next implication for professional and clinical practice is asking questions. As reported earlier, kids of all ages are willing to talk if you just ask the questions. How are you doing? How is school? Do you have some friends that you can lean on? How do you deal with those situations? Or as one of my participants, Jack, stated, what is your mental fortitude? Be proactive in seeking different opportunities to engage military students, because as much as possible, we want to move away from a reactionary care and we want to move into preventative care or early detection at the most. Here is a great opportunity to be able to engage students who are coming in as new students. One of the things initiatives that have been going across many schools that are military or have a high military population is a student ambassador club where students lead new students that are coming in, whether they are military or not. They engage them and they give them a sense of belonging within the school system by introducing them to many different aspects. They might take them to the counseling center. They might take them to a college center. They might take them to meet the MFLAC, which is the military family life counselor, if that's provided with the schools. They may even take them to the school office or the principal or assistant principal, so that this way they feel some sense of connection to the school. But I wonder how many take them to the school nurse. To the school nurse to be able to say, hey, this is, nurse so-and-so, and if there's anything that you need, she's always open to talk to, or he's always open to talk to. School nurses provide such a safe environment and a caring environment, and often their doors are wide open. But students don't know this. So being able to engage students and ensuring that we're asking the right questions, but also ensuring that we're introducing them to the right individuals who will ask the right questions is so, so important. So another thing that could occur is the continuous evolution of introducing military connected students, not just, okay, registering them, okay, here are their classes, now get going. It's much more than that. And it's really imperative that we continue to help and we work with these transitions. Nurses have a huge part in this. Now, the final point that I want to make here is highly mobile military children may seem as an at-risk population for health disparities. And yes, as military families, we do have access to healthcare. But due to the moves, there is a break in the continuity of care that's provided. Further, military-connected providers also move, which impacts the continuity of care that military children receive. And it becomes really straining and stressful on parents, families, and kids when there's a constant change in the providers, which is why you are in an invaluable position as nurses and community health nurses to be able to serve these kids right here, especially in the school setting. So I see a future similar to when children transition to different schools with their records in tow, that a standardized healthcare transfer form is utilized that provides an efficient handoff process when a family moves. So I know that there are medical records and all, but any of you who have worked within an EMR or electronic medical record before knows that navigating it takes really a big understanding of the picture, and it takes away from that big understanding of the picture from that holistic standpoint of the social, emotional well-being and the mental health. So one of the initiatives that I'd love to continue to work on and something to continue to focus on would be a handoff sheet that would allow students to be able to collect information from their current schools and be able to hand them off to their the schools that they're moving into. A lot of this information would focus on, the same things that they usually have in records, which are their academic progresses and some of the sports that they've been in, or some of the clubs, the extracurricular activities like band and orchestra. But also, what are some of the overall needs of the student? What are some of the overall, emotional supportive ways that they could also be supported when transitioning into a new school system? Another study that was conducted by one of my mentors, Alicia Rostetter, and I cannot remember the name of the pamphlet itself, but it was a card that military students or military connected families would be able to bring from provider to provider, and it would be filled out with a lot of information that would provide the new providers with a holistic view of the children and the family. Now, this is really important because we often think, okay, military moves, they're going to go to a military installation, they're going to have a military provider, the military provider is going to have access to their military records. It doesn't always work that way, especially in very congested military installations. Yes, on military installations, there are providers there and available, but many times there's not enough providers to be able to fill the growing needs of not only active duty military personnel, but also retired military personnel. So oftentimes the healthcare gets outsourced. Not to mention, there are many times that military personnel are stationed in non-military settings. They might be stationed in a university or college. They might be stationed in a recruiting station that does not have any MTF or medical treatment facility, military treatment facilities around. So having information that would allow families to be able to take with them from one duty station to the next and allow them to feel like they're coming prepared, so that this way all of their healthcare needs, from the mental health to the social emotional to the physical aspect, and all of it are met. All of it just really truly it would be a great resource to be able to have these almost I'd call them some progress notes that new providers can take in. So I really wanted to thank you for this presentation today. And I just really wanted to, again, hone in on a lot of the big points that were presented today. Military children and military adolescents, military families in general, they are a huge part of the community and a culture of their own as well. It's really important that communities embrace and continue to support military families, because oftentimes military families contribute to the overall environment of a community really well. And it's important that we understand the lived experiences that they go through. Oftentimes, military families, many people feel like military families have all the support that they need on an installation. However, most installations, if not all installations, cannot possibly meet the housing or the, all of the needs that the military families have. It's oftentimes it's just a large population. So it's really important that the surrounding communities of installations are there to be able to provide that need. And nurses, again, are positioned in an amazing way within the community and within healthcare settings, whether it's in the clinic or whether it's in the military treatment facility, nurse practitioners and providers, to be really able to engage military families and military children in a discussion that opens the doors for them to be able to talk about what's impacting them and how things are impacting them, and all of the military, the experiences that they go through. Oftentimes in the military, and I've heard this over and over and over again throughout our military career, is that family readiness is soldier readiness. We hear that over and over and over again. Family readiness is soldier readiness. So it's really important that the families are taken care of. And that is the gist of my presentation. If you have any questions at all, this is my personal email address, and I am available at any point. I love collaborating. I love speaking with nurses from many different backgrounds, and I love seeking new opportunities to continue to conduct research or to provide education. So if you'd like education to be provided at anywhere, please let me know. And I do look forward to really hearing from you about the self-reflection that you guys have gone through, and really understanding some of those points of how you might change your practice in order to meet this population's needs. Thank you so much.